Since 1994, the HIMSS Nicholas E. Davies Award of Excellence has recognized outstanding achievement in generating improvement of care outcomes and return on investment using health technology. The latest recipient for this award was the California Correctional Health Care Services, CCHCS, for leveraging the value of health information and technology to improve outcomes by improving advanced liver disease outcomes using patient registries. Advanced liver diseases has been a major contributor of mortality and morbidity among the California Correctional Healthcare Services population over the past decades. The CCHCS housed 125,000 inmates. Two-thirds of that population have a history of substance use disorder. 15% of that population is known to have chronic hepatitis C, and 1.6% of the population, which is about 2,000, were identified with having cirrhosis or end-stage liver disease. These diseases are the second or third leading cause of death among the adult offender in the prison system. The life expectancy of people with end-stage liver disease is reduced due to the severity level of damage to the liver. And in the correctional level, inmates do not qualify for liver transplantation. The problem the correctional healthcare system was facing was that their primary care clinicians did not have the training or experience on the private practice on cases of advanced liver disease patients. The second one was the organization didn't have clinical guidance or decision support for their physicians. And because on average, an inmate will be moved at least once a year, the correctional didn't have an EHR, so they couldn't identify, track, or monitor patients throughout the system. The CCHCS decided to utilize the data sources they have available and find a way to offer better care for people with advanced liver disease by identifying and diagnose patients on an early stage and try to reduce preventable morbidity and mortality rates through improved continuum of care. With their in-house talent, clinical and technical, plus the SQL healthcare database warehouse as existing resources, they were able to create a tracking system for performance measures and registry to keep track of their patients throughout the correctional system. The ESLD registry is a SQL Service Reporting Service report that pulls data from the back-end SQL Service data warehouse. The SSRS is a Microsoft commercial off-the-shelf product that allows staff to build this front-end report. Then it allows the rest of the staff to access these through a web-based portal and have multiple data sources. The registry they created provided the clinicians team with information about the advanced liver disease patients, current housing statewide, so they could track the inmate and the service or treatment they were going through. Since the system had the filter feature, clinicians could bring information about all inmates being treated at the statewide level and just under their care at the specific institution. Color coding was another useful feature for the team. The end user report displayed red color fields for overdue tests, missing ultrasounds, or inmates who are not receiving proper medication for their associated conditions. They also offer the color yellow for the tests that they were soon to be due. Usually 30 to 6 days before the test was due, you can see the color changing to yellow. The system also has a healthcare service dashboard that monitors and gives scores to present compliance with the guidelines and monitor how the organization is doing on an overall view. It measures the compliance. It also measures if the patient are receiving the correct treatment and medication. These scores get calculated statewide, institutional level, or team level. This help the care team or patient panel to know what areas they need to improve or if it can be done to get a better overall score. In this picture, you can see the healthcare service dashboard and the different colors. I'll explain to you in a little bit what the different color means. The dashboard, like the registry, collect coding to see how well the process is working. So the different colors, if you are on a green, that means that you are at 90% compliance. If you score on the yellow, that's 80 to 90% compliance. And if anything on red, that means that you are below 80% compliance. And then that means that you need to improve. Also, this one give you the breakdown of the patient, and with that it will explain to you what piece of compliance you need to hit in order to get a better score. Here is where the data sources such as EHRs, legacy system, flat files, and SOMS file or custody applications get into the extra transform load. The ETL turn raw data or raw information into a more structured, usable information into the data warehouses and allow front-end users to do data mining, create reports, answer questions that executive leadership might have about how a certain program is doing, or as well as the registries or the dashboard that we saw earlier. The CCHCS was able to see an improvement in their performance measures by 27% in under 2 years. And although I was not able to find the stage level of maturity for the California Correctional Healthcare Service, I believe that they were about like the level 6 or 7, because the way they were using the data and how they were able to use the technology to enable certain medications. So this is all I have. Thank you for listening.